medical treatment. In just 9 words, our Constitution affirms the value of every Kenyan life and establishes an obligation that binds every government, every health institution, and every health provider. Yes, too many Kenyans, and for too many of them, this constitutional guarantee has remained beyond reach. In the critical moment when a mother develops complications during childbirth, a child is injured in school, a rider is knocked down on the highway, or a father suddenly feels a tightening in their chest, families have often been left to fend for themselves. In a medical emergency, every minute matters. Doctors call the first 60 minutes the golden hour because what happens during the brief window can determine whether a patient lives, recovers fully, or suffers permanent injury or even death. For too long, the fate of a Kenyan facing an emergency has depended on 3 things: the money in their pocket, where they happen to live, and who they happen to know. That is not the equality promised or the guarantee given or envisaged by the Constitution. It is playing a lottery on human life. Today, we change that, and we change it permanently. We are turning a constitutional guarantee into a service that every Kenyan can reach through the launch of the SHA 922 Lifeline and the National Ambulance Dispatch Center. From today, Kenya has one national medical emergency number, 922. I remember when we discussed this subject with my good people at the Ministry of Health and at the Social Health Authority. And we had to negotiate with the IG. I remember calling Douglas there and asking him between 911 and 922, which one are you surrendering? And he told me, let me think about it. I will come back to you, Mr. President. Today, this is more than an emergency telephone number. It is a national lifeline. It connects a citizen in distress to emergency medical assistance, an available ambulance, an appropriate health facility, and the public financing required to pay for that intervention. When you call 922, the call will be free on every network, and it will be accessible whether you have airtime on your phone or not. A trained emergency dispatcher will answer, establish your location, and assess the emergency. The dispatcher will remain on the line, provide immediate assistance, and identify the nearest available ambulance. Through the National Digital Health System, the dispatcher will also identify the nearest facility capable of treating the patient's specific condition. The objective is not simply to take the patient to the closest hospital, but to take them to the facility best suited to save their lives. Ambulance evacuation and the first 24 hours of emergency treatment will be paid for through the emergency, chronic, and critical illness funds at the approved tariffs. This protection applies whether the patient is registered with SHA or not, and whether or not they have paid for SHA. No deposit, no guarantee, no negotiation, no relatives running around looking for money. Everything will be taken care of. In an emergency, the first question must never be whether a patient can pay. The first duty is to save life. And this is not just mere government policy. It is a constitutional requirement. I therefore reiterate to every health facility contracted by SHA, no person requiring emergency medical treatment shall be denied, delayed, referred, or transferred because they cannot pay, because their cover cannot immediately be confirmed, or because a form is incomplete. They should be served. This is equally an essential national service anchored in the health reforms we have implemented since 2023. Today, I can face the nation and say 32.2 million Kenyans are registered with SHA. 8 million Kenyans have received treatment in the last 18 months, and 178.5 billion has been paid to hospitals, health centers, dispensaries, and other medical facilities. It would have taken the former NHIF possibly 6 years to pay what we have paid in 1.5 years. We have trained and deployed 107,000 community health promoters to take preventive and primary health care directly to households. The Primary Health Care Fund has so far paid 23.3 billion to more than 10,000 health facilities contracted by SHA, directing public resources to the dispensaries and health centers closest to the people. More than 50,000 Kenyans have received cancer care, while nearly 21,000 patients have received dialysis through the national health system. The Emergency, Chronic, and Critical Illness Fund, financed entirely by the government, has received 8 billion shillings to protect Kenyans when every other safety and safety net runs out. The 922 Lifeline now brings these reforms together. And I'm very proud, by the way,